My name is Heather Butler. This is my Persuasive Speech for Communication 1010. Today is May 31st, 2012, and this is my audience. My speech today is on the AV fistula buttonhole technique. The general purpose of my speech is to persuade patients who have an AV fistula or who will be having an AV fistula placed that the buttonhole cannulation method is the best method for their AV fistula. Today, I want to present with you concrete evidence regarding the benefits of the buttonhole cannulation versus the standard cannulation method. Have you noticed those large, shiny lumps around other patients' fistula? Did you know that with the slightest bump, those shiny areas, the patient can bleed to death in a matter of seconds? Patients with AV fistula have a choice of how they would like their access cannulated. Since the fistula is their lifeline, the patient needs to use the best technique that will maintain the functioning and health of their AV fistula. I graduated from Louisiana State University in Alexandria in December of 2005 with an associate degree in nursing. I'm currently pursuing my bachelor's degree in nursing at Northwestern State University. I've been in the dialysis field since June of 2006, and I've been the manager of an outpatient dialysis facility for the past 2 years. I want to provide you with concrete evidence regarding the benefits of the buttonhole cannulation versus the standard method cannulation for your AV fistula. I will explore the buttonhole technique cannulation of the AV fistula, which will improve fistula outcomes. So with the buttonhole technique, we will have a decrease in infiltrations, infections, longer life of the AV fistula as opposed to cannulation with the standard method. First, I would like to tell you about each method of cannulation for the AV fistula. According to an article in the Nephrology Nursing Journal in 2010, the rope ladder technique is a technique which requires rotation of puncture sites with each dialysis treatment. It's aimed at preventing the AV fistula from repetitive needle punctures in the same area. The area puncture technique is a technique that involves cannulating in a circumscribed area. The buttonhole technique, this is a method of puncturing the AV fistula where the same exact point of puncture and alignment are used in consecutive dialysis sessions. By using the same exact entry point for a period of weeks, a tunnel is formed in the surface of the skin to the fistula, surrounded by a wall of scar tissue. This same principle is the principle we use in ear piercing. We've identified the three methods of cannulation. Now let's take a look at some of the advantages and disadvantages of the three methods. The advantages and disadvantages of each cannulation method. The first one, the rope ladder technique. According to a study in 2011 in the Nephrology Nursing Journal, the advantage and disadvantages of the rope ladder technique are, some advantages are, if properly used, minimal aneurysm formation. It's quick. 2 sharp needles are inserted into the fistula and you're done. Disadvantages, you're more likely to infiltrate with the use of sharp needles. You have more painful cannulation. Stenosis will form, which is a narrowing of the fistula. It's more prone with the use of sharp needles. Another disadvantage, higher risk for access failure. Takes longer to stop bleeding post-treatment when the needles are pulled. And also you run the risk of infection. The area puncture technique, some advantages and disadvantages of it. The advantage, it's quick. Disadvantages, It's painful, you have multiple aneurysm formation, and it has the greatest risk for access failure. Infection is also a possibility with this type of cannulation. This technique should be avoided. The buttonhole technique, the advantages of it are it's less pain, which was reported by patients. It's least likely of the three methods to form an aneurysm. Can be used in smaller fistulas where the rope ladder technique is not an option. Bleeding times after the needles are pulled, it's cut in half. And after the buttonhole is established, rarely will a patient have an infiltration. Another advantage, you're less likely to suffer access failure. The disadvantage, reports of infection have been seen with this technique, but with proper cleaning, proper sterilization, pre-cannulation, you shouldn't have problems with infection. Infection is seen in all three cannulation methods. We've looked at the advantages and disadvantages of each method. Now, let's consider the most logical method, the buttonhole technique. Patients have the right to decide which method they would like used on their fistula. As the patient sitting in a dialysis chair for 4+ hours, 3 times a week, do you want to experience pain often? According to Axley in an article in 2012, you will have the least amount of pain associated with the buttonhole technique. Do you want to run the risk of developing life-threatening aneurysms? According to Pergotti in 2011, the buttonhole technique has the least amount of aneurysms seen in a study. Do you remember what it was like having to wake up early one morning on a day that you weren't scheduled for dialysis, but you had to go to the hospital to have surgery to have that fistula created? If your access fails, you'll have to relive that surgery. The buttonhole cannulated access has the lowest rate of access failure according to Ludlow in an article in 2010. We've explored the 3 techniques that an AV fistula can be cannulated with. We've looked at the advantages and disadvantages of each method. We've seen that the buttonhole method of cannulation is the best for your AV fistula. Today, I want to present with you concrete evidence regarding the benefits of buttonhole cannulation versus the standard cannulation method for your AV fistula. You did not choose to have kidney disease. That was not your choice. How you survive with the disease is your choice. You can make the best choice for your life and the life of your access. The right choice, the most logical choice of cannulation for your AV fistula is the buttonhole technique. Thank you.